We're at HIMSS 2015. I'm Mark Breesacker with Intermountain Healthcare. Joining me today is Lisa Pettigrew from CSC. Lisa, tell us a little bit about what you do with CSC.
Thanks, Mark. It's great to be here. What a fantastic Intermountain presence. Lisa Pettigrew. So I'm the General Manager for Global Healthcare at CSC, Computer Sciences Corporation. So I look at how to glue together some of the best innovations in healthcare all around the world.
In terms of what we're doing with population health management, it's a hot topic here in the States, certainly an important thing that we're working on at Intermountain, but you have a perspective that kind of with what the rest of the world is doing. So tell us a little bit about that.
Sure. Look, it is a hot topic around the world. So when we look at the market size here, the population health management industry is starting to be measured at a growth of over 24 or 25% above any other industry. So this is a growth area across healthcare globally. One of the most important discussions in every country, I find, is how to get the patient more engaged. So much of this is in response to the changing patterns of disease. And patients who want to be more engaged, who've been living with their diseases longer. In the UK, we've just started what we call the Population Health as a Service, where we are working with something that is a little bit like an ACO. It's a clinical commissioning group. And we're helping create a patient care coordination centre that helps a population of almost 250,000 people. We help organise and coordinate the care logistics on an outcomes-based model. So we're working through what are the new service models? How do you measure the outcomes? How do you change what the clinicians have to do? And in particular, how do you treat patients differently? And one of the expressions we've started to use and our clients in the UK are using is we're treating the patient as an expert in experience. So we're trying to give them that priority, just like a physician who has experience through, who has expertise through experience. So that's one of the patterns we're seeing about how to engage the patients more strongly, both the activist patients, but also some of the more reluctant patients to understand more about their own conditions and what they can do.